There's growing concern that there's a mismatch between who's getting the COVID-19 vaccine and who's actually being most affected by the pandemic. In Texas, for example, Hispanic people make up 15% of people who've been vaccinated, but 44% of total cases and nearly half of all deaths. I'm Veronica Rickard, and this is Badger Talks. Tiffany Green is here with us. She's an assistant professor in the Department of Population Health Sciences and OBGYN at UW-Madison School of Medicine and Public Health. Dr. Green, thank you so much for talking today.
Thank you for having me.
Well, Dr. Green, how would you describe the disparities that we're seeing between who gets the vaccine and who's suffering the most from the pandemic?
Unfortunately, we're seeing the same racial disparities in the distribution of the vaccine as we're seeing with COVID-related morbidity and mortality. In Wisconsin, Hispanic Americans are more likely to be diagnosed with COVID. Black Wisconsinites are more likely to be hospitalized with COVID, and Native Americans are more likely to die from COVID relative to their white counterparts. Yet, when we look at who's getting the vaccine, a greater share of white Wisconsinites are getting the vaccine relative to other groups.
So what is going on? Why is there this disparity between who really needs the vaccine because that community is being hard hit and who's actually receiving it?
I think the disparities in vaccination are a reflection of the underlying disparities that drive COVID-related morbidity and mortality in the first place. Lack of access to healthcare, challenges with gaining trust of communities based on historical and present challenges and abuses, and also, frankly, a lack of full coordination at the federal and state levels until very recently makes all of this an operational challenge.
You mentioned the word trust, and I know that's come up in this discussion before, both trust to actually get out there and get the vaccine. And there's also been some data, some discussion about lower levels of trust for the vaccine, and particularly in the Black community. What do you make about this whole issue of trust, and where do we need to put our focus when we talk about trust?
I think, first of all, we have to remember that trust is a very political term. We saw very politicized vaccine development and distribution. And even though the process was scientifically transparent and rigorous, that didn't help the process. I also think that we're seeing much more convergence in terms of racial differences in trust for the vaccine. We've seen upticks among all racial groups, and particularly Black Americans, in wanting to get this vaccine. Now we have to really focus on the distribution and the fair distribution of those vaccines.
And how do we do that? I know you've mentioned community centers as one possibility. What do you think about that and other options?
I think it's important that we take the vaccines to communities that need them most, and to be quite frank, make sure that the people living in those communities are the ones that get the vaccines and not people coming from outside those communities to get vaccines. We also have to make sure the people that are talking about them and administering them have a track record of trust that they have gained in the community. This can't be something where we have people coming in and giving vaccines and talking about them who aren't known in the community and haven't gained that trust.
Do you think we're starting to pull the wheel in the right direction on this, or do you see this as a problem that's only growing as we go along with this vaccination effort?
It's really hard to say. There are some places that I'm sure are doing it well. I know that we just opened a clinic in Rock County for communities, and it will remain to be seen whether that's an effective approach to vaccinations. So I'm hopeful, but I say we will have to wait and see.
So I'm curious, when the pandemic is over, or at least when it starts to recede, where do you think we need to put our focus so we can do better in these sorts of race-based healthcare disparities that we're seeing now?
I think we've seen that this pandemic makes so clear that we need more universal coverage. Pandemics don't discriminate. We need people to have access to healthcare so that they can be tested quickly, that they can get treatment quickly, and we have measures to support them if they're out of work, such as unemployment insurance and other sorts of income transfers. Those are the things that were needed to mitigate the impacts of this pandemic. And I hope that we've learned a lesson that putting these things in place before we have another disaster will help to mitigate the effects of the next one. And it's coming.
Dr. Green, thank you so much for talking today. I really appreciate your time.
You're very welcome. Thank you for having me.
If you have questions for us or topic suggestions or want to comment on this Badger Talk, send us an email at covid19update@uc.wisc.edu. And for more info, you can go to covid19.impact.wisc.edu. This is Badger Talks.